So sometimes people have high blood pressure. Sometimes people have high cholesterol. Those are symptoms of a metabolic problem. But in modern healthcare today, we never go after that metabolic problem. We're always medicating for those symptoms. And so functional medicine is just a little bit different in that we're always going to work backwards and try to find the root cause. Here's the secret, is that most chronic diseases in the United States today are actually an adaptation response. You want to be able to understand why did they have diabetes? What is driving it, right? And how do we allow it to dry up? They're not asking, why is your cholesterol 275? Okay? They're not asking that. If you ask why, that's a whole new set of laboratory values that need to be run that can help you figure that out. Is it being driven by your diet? Is it being driven by your genetics? Okay? You can sort this stuff out. It's not hard, it's just very specific. And in the insurance model, they don't really take care of that for you because they're just looking for what med to plug in. Think about the driver of cholesterol production by your liver is inflammation. If the inflammation remains, but you lower the cholesterol content, now your ability to go and patch all of that damage has been decreased. That damage is still there, right? So so what we've done is we've put together Casual Friday to teach people how to help their patients get better results faster. We are actually changing the face of healthcare, okay? And what happens is people begin to improve, and they're like, oh, I didn't know that, you can see these issues reverse. You can see these symptoms decline. And it's like, yes, you didn't know that because your body has been struggling with 86 problems that it can't heal. And all it requires is somebody to help organize, push you in the right direction, right? And then consistency. Your body's designed to heal. We take advantage of it every day. I mean, last year I crossed the 25,000 case mark in my career. Okay, 25,000 cases, and last year I think I did 3,000 cases working with other clinicians around the country, medical providers, DCs, DOs, etc., NPs, DNPs, and the point is that what we want to do is we want to inspire people to take back control of their health instead of just going to the provider and being like, how come you can't fix me? It's not your doctor's job to fix you, okay? It's your job. They're not the one living in your body. That's you.
So when we have a health problem, we are looking for a solution and we are looking for a specialist. And if it's an isolated issue, that may work very well because you go to a doctor, to a specialist, you get the problem fixed. And that's very good for you. But when it comes to chronic diseases, it's almost never that simple because our body is complex. And people get very frustrated because they go from a specialist to a specialist to a specialist, and they still don't get better. And the problem is that if our body is so complex and everybody has that specialty within their own scope of practice, not only how do they communicate, who do I see next, but there are many questions. What is the lab work really telling me when you look from another perspective? What should I do? And most importantly, who is here to guide me to better health fast because I don't have time? So that problem is a huge one for a lot of people because a lot of people have chronic diseases, and functional medicine may be the solution you're looking for. So today we're going to talk about functional medicine. We're going to talk about the concept of how functional medicine helps chronic diseases and how Dr. Brad Watts, our guest today, encourages people, providers, to collaborate because it shouldn't be one or another. It should be the combination of the medical world and the conventional medicine together with the functional approach that is going to get you and your patients better. I am here with the person I respect so much, and I'm super excited because Dr. Brad Watts is a world-renowned expert in functional medicine, clinical nutrition. He started a podcast for providers to teach them how to help their patients faster. Once again, welcome to Polish Your Life Network. I really appreciate you here. Let's talk about functional medicine, why it's so effective, and most importantly, what are you doing? What is your mission in life that we just talked about?
Absolutely. Happy to be here, Mike. So thanks for having me. And it's been a while since we've connected on a platform like this, so this is good.
That's great.
Very good. So I like what you're doing. I appreciate you connecting people, providers in the marketplace and making sure that everybody gets to coordinate, because at the end of the day, it always has to end up with better results faster. And that's the whole point. So anyway, I like it.
Thank you.
So we're talking functional medicine today. Where would you like to start? I am happy to go wherever you'd like to lead.
Yep. Let's start where people are. So we have some people who know what functional medicine is in
Okay.
general. And then for those people, we want them to fast forward maybe the first 5-7 minutes because
Sure.
you already know the basics. But if you don't know, let's start with the basic concept. What is functional medicine?
Sure. Functional medicine is just a viewpoint, a way of looking at the body as it relates to healthcare. So, most of the time you go to the doctor says, oh, you have these symptoms, you have this laboratory finding, and that means you have this condition. And in functional medicine, don't take this the wrong way, but in functional medicine, we don't really care what the condition is. We just want to know why it's there. Because if you can lay an axe to the root of a problem, then the fruit stops showing up. And that's ultimately what we're looking for. So we'll use laboratory diagnostics like blood chemistry, saliva testing, urine samples, stool samples, etc. We'll look at all of that as needed, and we'll develop a plan to help get the root of the problem to dry up so that you stop having the fruit. So sometimes people have high blood pressure. Sometimes people have high cholesterol. Those are symptoms of a metabolic problem. But in modern healthcare today, we never go after that metabolic problem. We're always medicating for those symptoms. And so functional medicine is just a little bit different in that we're always going to work backwards and try to find the root cause. So, like right now in the United States today, almost 10% of the population has type 2 diabetes. That's a lot of people, 330 million people in the United States, 10% of them dealing with type 2 diabetes. The undiagnosed type 2 diabetes puts us up above the 35%, somewhere in there. It's crazy town. And so it's one of the largest expense drivers in the healthcare marketplace today. And ultimately, it's a silent disease, and it's people are rotting from the inside out. They don't need to be. And so what you want to do, like in a functional medicine approach, is you want to be able to understand why did they have diabetes? What is driving it, right? And how do we allow it to dry up? So here's a secret with chronic disease. You brought up chronic disease, so we're going to talk about this.
Yep.
Here's the secret is that most chronic diseases in the United States today are actually an adaptation response. Okay? The body's trying not to die, so it develops a chronic disease. Right? So since we're talking about diabetes, let me just explain this real quick. So for how a patient creates energy, how you create energy, Mike, is you breathe in oxygen, you eat food, your body mashes the two together and gives you ATP energy. And then you go, exhale CO2, okay? That process is happening all the time. Breathing, eating, energy, exhale, okay? A side effect of that process is creating inflammation. Okay? When that inflammation becomes too much, when your body can't clean up the results of that inflammation, your body begins to develop something called insulin resistance, which is type 2 diabetes, okay? It's a protective mechanism because your brain is hardwired for longevity. Your brain's trying to make it to 100, buddy. All right. And what happens is, yeah, or more is right. And what happens is because your brain is wired for longevity, it makes decisions with longevity in mind. Okay. What that means is that your brain can't make it to 100 if all of the cells are dead in the rest of your body. Okay. So the side effect of inflammation is cell death. Okay, that's how you kill a virus like COVID. You create inflammation, and the inflammatory issue kills the cell. Okay, same thing when we have a lifestyle that's not compatible with health and healing. Is your body is constantly creating inflammation, and so your brain starts saying, "Well, let's stop making so much inflammation." How do we do that? Stop taking oxygen and food and mashing them together and making energy. Okay, so your brain has to stop making energy in order to calm down the inflammation. That's called type 2 diabetes. And so what happens is people go to the doctor with type 2 diabetes and their blood sugar's high. They got a high risk of heart attack and stroke. They can't feel their fingers or toes anymore. Their eyesight's starting to dim. And what happens is they go to the provider and the provider says, oh, you have high sugar. Well, let's take that sugar and let's wedge it into that cell faster. Exactly the opposite of what the brain is telling the body to do. So you got the doctor on one side and you got the patient's, inflammatory response on the other. And they're just going back and forth trying to manage the diabetic condition. And that's the key word, manage the diabetic condition. Because ultimately, is the manager of your local McDonald's trying to kill the business? They're trying to perpetuate the business, okay? And that's what happens in the chronic disease world when you have a bunch of people managing conditions, is they never go away. They never go away. And so in a functional setting, what we want to do is we want to be able to understand that mechanism that I just described. You can see it at work. It's the same mechanism that heals the edges of a cut together. Okay. That same power in your body is what's working on keeping you alive with type 2 diabetes. Okay. And what happens is that when you can see what it's up to, what it's actually doing, when you can catch it at work, you can work with it and amazing things happen. People lose weight. Their blood sugar comes down, right? Their fingers and toes stop being so painful and numb. Their eyesight can oftentimes return. Erectile dysfunction function returns. And what happens is people begin to improve and they're like, oh, I didn't know that, you can see these issues reverse. You can see these symptoms decline. And it's like, yes, you didn't know that because your body has been struggling with 86 problems that it can't heal. And all it requires is somebody to help organize, push you in the right direction, right? And then consistency. Your body's designed to heal. We take advantage of it every day. And the same way that it heals the edges of that cut is the same way it will heal metabolic disease, endocrine dysfunction, obesity, heart disease. It's amazing. It's amazing. So,
Wow.
yeah.
The explanation that you give and the way that you talk about it, I hope that everybody out there feels the passion. What I know about Dr. Watts and his mission, when you find out what he's doing, you're going to understand what is the fuel for that passion. And then back to the conversation that we have, I want to talk about that example with a cut that you mentioned, because it's a very good one. I was just watching your video with the group of doctors with Dr. Carberry, and you were talking about healing that cut. And what is your body? What do you need to do to heal that cut? Right? So people say nothing because it heals itself. We talk about innate intelligence. We talk about our body's ability to heal, to get better. And it is all true, but there is also something you got to do to heal the cut.
That's right.
What is it?
So like if you wake up, Mike, in the morning and maybe you're cutting some meat for breakfast or something like that, right? Because I know how you eat. You're cutting some meat for breakfast and you got a knife and you slip and you miss and you gash your finger and it starts bleeding, right? You wrap your napkin around or whatever and it stops bleeding after a little while. Over the next 2 weeks, it's going to heal. Okay. And the question that you posed is what did you have to do in order for that cut to heal? And almost everybody says nothing. You don't have to do anything. It's part of who you are. Well, you actually did have to do something. You had to stop taking that knife and opening the same cut every day. You got to stop opening the same wounds every day. Otherwise, they'll never heal, right? And that's the problem with chronic disease, whether it be thyroid disease, gut dysfunction, Crohn's, liver problems, okay, whether you're talking about cognitive decline, Alzheimer's disease. These are all there are areas in your lifestyle, okay, mechanical, chemical, psychological lifestyle. There are areas there where you are essentially opening that wound every day and then complaining about it and going, well, just stinks that I'm afflicted with this problem. Okay. When what I want you to do is I want you to shift how you're thinking about it. And instead of feeling afflicted, right, get excited because you should be able to figure out what that knife is and why you keep dragging it over that same cut every day. And once you see it, you'll never unsee it.
Yeah.
Once you see it, you're going to be like, oh, I actually have control over this. This is amazing.
Yeah.
So, and that's essentially how it works. And in my job as a clinician, or I'm classically trained as a doctor of chiropractic, and I have this specialty in functional medicine and clinical nutrition. And my focus is on coaching patients in the right direction, because it doesn't matter what you know. You could be Albert Einstein. I don't care. Right? It only matters what you can explain and what you can help people understand, because people are only going to do something if they can understand it. Right? And it's amazing. So that knowing that and being able to shift people's mindsets and coach them in the right direction is destroying chronic disease all throughout 2020, 2021 so far. It's amazing. It's destroying chronic disease. And that's really the joy of what I get to do. So,
Man, this is so powerful, really so powerful. And for all the providers watching, because in the context of our doctors networking group,
mhm.
I believe that it is much better to live in a supportive environment. The world needs more people who care, and they are out there, but sometimes they don't form a community, or they don't form enough of those communities and communicating that message to people. And that's what we are building with Polish Your Life. It's a group of those healthcare providers
That's
trying
right.
to collaborate together to have the best clinical outcomes. And for all the providers watching, what I want you to realize is that what is obvious to you, meaning you have a proper lens because you've been trained in that, and you see that somebody's taking a knife
Yeah.
or a pen
Yeah.
and cutting their finger, and
Yeah.
for you it's obvious, but when the patient comes to see you, many times they don't know that they're
Right.
opening the same wound, and it's your professional moral responsibility to explain to them what's happening and tell them what they should do. And that's where communication, like you mentioned, it's not only the knowledge, it's the communication of that
Yeah.
message that is so powerful. Let's talk about an example, because I love another video that you did, and I think that was on your Nutrition Hero podcast. It was something about understanding cholesterol, and your patients may be coming to you saying, yeah, I have high cholesterol, but it's genetic.
Yeah.
What would you say to that?
Sometimes I'll say this. You come to me and say, "Hey, doctor said that my cholesterol is elevated, but it's genetic, so don't worry about it. And just take this medication, and you'll be all set." And there's a lot of value in cholesterol medications for a lot of people, so I don't want to discount that. However, I also want to say that cholesterol sometimes is genetic. So there are a bunch of different causes for it, but in general, you can think about the driver of cholesterol production by your liver is inflammation. Okay. So, like, it looks like you're sitting in a nice office there. So, if you get angry, right, and let's say I say something to you that makes you angry, Mike, and you turn around and you put your
Can't
foot,
imagine that, but try.
yeah, you put your foot through the sheetrock in your office, right? Well, you're going to have to stay after we're done here today and patch it up so it doesn't look ridiculous. Okay. And that's a repair process that's taking place. Well, your body produces cholesterol to go and repair the damage caused by inflammation in your cardiovascular system. The same way that you put your foot through the sheetrock, you'll have to, like, put more sheetrock over it, tape it, mud it, sand it, paint it. Cholesterol is doing all of that inside of your cardiovascular system. So inflammation oftentimes acts like little razor blades in the inside of your arteries. Okay. And it goes through there and it just starts hacking things up, creating an inflammatory response. And cholesterol comes along, and the brain says, oh, look at all this inflammation. Let's make some cholesterol to go and patch all of that damage. And over time, if we don't control that inflammatory issue, cholesterol starts to pile up, starts to block those arteries, right? And now blood flow is decreased, and we end up with, atherosclerosis and chronic heart disease, and end up seeing, the good cardiologist that's like, yeah, this is not good. Okay. And understanding that mechanism really should start in your 30s and 40s, and making sure that you're not driving those inflammatory problems, that you're living a life compatible with health and healing instead of a life compatible with, chronic disease, heart disease. And ultimately, dampening those inflammatory levels is what allows us, to have a lower cholesterol content. If the inflammation remains, but you lower the cholesterol content, now your ability to go and patch all of that damage has been decreased. That damage is still there, right? So it creates a whole new dynamic as far as stressors are concerned, and we end up driving inflammatory levels in the long run. You asked, so we're going to go here. Okay, is this all right if I go one
Yep.
layer deeper?
100%. 100%.
Okay.
And I want people to have a sample
Yeah.
of with the functional medicine analysis of a situation. And keep in
Sure.
mind, we are not giving you medical advice with this video.
Yeah.
This is not to replace your doctor's advice. And it may be confusing to some because it actually sounds so cool that you want to follow the advice, but pay attention because the body is so complex that you need a
Yeah.
very good guide and probably a team of doctors to give you the correct diagnosis and course of action you should take. But
Yeah.
yes, let's go one layer deeper. Let's
So
tell people a little bit more.
that inflammatory issue that's happening because of our genetics and lifestyle. Okay, so genetics are like a filter that your lifestyle is pressed through. Okay, so a filter. So genetics don't cause everything, and lifestyle doesn't cause everything. It's the combination of the two of them that do. So if you have crappy genetics, you need to make sure that you live in a lifestyle that is up to par. Okay, so here's the thing: generalized inflammation. So chronic inflammation because of the air we breathe, the water we drink, the food we eat, okay, the garbage we watch. Chronic inflammation over time becomes specialized. So have you ever seen, like in the military, you have a general infantry soldier, Mike, and they get bored with their job and they decide, you know what, I'm going to specialize. I'm going to go and I'm going to become a special forces soldier or something like that. So they go from, going into the Navy and then they want to become a SEAL, right? Or they're, in the Marine Corps and they decide that, you know what, I really want to be an Army Special Forces soldier, which is what happened with my brother-in-law. Okay. He went from the Air Force to Special Forces. And so what was happening is they start to specialize. Your immune system activity, inflammation, will go from general over a long period of time. It begins to specialize and narrow the scope. And this is where we end up with chronic diseases like Crohn's disease, atherosclerosis, thyroid conditions, Hashimoto's, diabetes, gut dysfunction. Okay, this is how this happens. You have general inflammation that becomes specialized over time, and now you get a diagnosis at the doctor's office. Okay, so the diagnosis is the fruit of the tree, right? The generalized inflammation is the trunk, the root of the tree. So in order to get a tree to stop growing fruit, what do you have to do? You can't just pick the fruit off the tree and constantly be medicating the fruit. You have to be able to lay an axe to the root, so to speak, so that that tree is no longer able to produce that fruit anymore. Okay. Now, in the context of cardiovascular disease or high cholesterol, what would this look like in a functional medicine setting? What I would want to know is, do you have the genetics for high cholesterol? Is that a driver in your family? So I'm going to look at your genetic profile. What are the inflammatory levels like in your blood chemistry, right? Do we see inflammation active? I got to see that so that I can know how to, coordinate with you and create a scenario where that begins to heal. I want to know, what's your lifestyle? What's your food look like? Is it the cholesterol in your food that's causing the problem? Very rarely. Okay. Usually it's food causing inflammation that makes your liver produce the cholesterol. Okay. So very rarely is it the egg you're eating. Very rarely is it the butter you're eating that's causing a problem. Almost always it's your body's response to the food you're eating that's driving the cholesterol production. So hopefully that makes sense. Okay. It's not in the food. It's because of the food. Okay.
It does make sense. Yep.
Okay.
And
So
also
go ahead.
let's also, while we are talking about cholesterol, let's
Yeah.
interject one quick message, because when people look at numbers, they look at
Yeah.
numbers that are incomplete. So
Yeah.
there are many different factors, ratios, and particles within those particles that
Mm-hmm.
should be analyzed. And I just want people to know, without going another layer
Right.
deeper, right?
Yep.
That something like that exists, that you cannot just say, hey, you have a high LDL, you have this
Right.
problem, because it's not enough. So sorry to
No,
digress
that's
a little
okay.
bit, but I think it's important too.
So what happens is you go to the typical doctor that's going to run your insurance card for the lab, right? And that doctor knows about all the stuff I'm telling you about right now. Okay, they know. They're just not able to participate on the same level because the insurance company is deciding what tests to run. Okay, now the insurance company only wants to know enough information, laboratory information, for the doctor to make a clinical decision on what medication to give you. Okay, so lab information, medication, they just got to connect. So when you get a typical blood chemistry run, you're essentially only getting checked for medication dosing strategies. Okay, you're not asking the question why. They're just asking what. What's your cholesterol value? Okay, how come they're asking what? Because I want to know if I need to give you medication to plug in yet. Okay? They're not asking why is your cholesterol 275. Okay? They're not asking that. If you ask why, that's a whole new set of laboratory values that need to be run that can help you figure that out. Is it being driven by your diet? Is it being driven by your genetics? Okay? You can sort this stuff out. It's not hard, it's just very specific. And in the insurance model, they don't really take care of that for you because they're just looking for what med to plug in. So hopefully that makes sense.
Yes,
Okay?
and thank you for explaining that.
So when you have this scenario where you have now all of this laboratory data that tells us why a patient feels the way they feel and is functioning the way they're functioning, what we can do now is develop an intervention. The intervention has to be able to handle the issues we found. We call that a functional assessment. Okay. So I want to know, how is the patient functioning? Once we see that, we can handle whatever the food issues might be. Maybe you got food sensitivities. Maybe you shouldn't be eating some of the food you're eating. Maybe your body doesn't like corn. Maybe it doesn't like wheat. Maybe it doesn't like both. And what happens is we got to be able to interject and have an intervention that says, hey, Mike, time for you to stop eating these foods. Like, what if it's blueberries and you have no idea, right? You got to stop eating these foods that are causing inflammation, right? So am I saying that blueberries can cause your cholesterol to go up? Yes. Okay. Because what if that's causing inflammation for you? That could be the driver. Okay. And so you got to handle that. Sometimes people don't detox very well. Sometimes people are living in a house that has mold in it. And so they're breathing mold in all day and they don't know that's what's causing their cognitive decline. They don't know that's what's causing their diabetes or their Crohn's disease. They have no idea. Okay. And so what you want to do is you want to find out what are those contributing factors and then develop an intervention that allows those contributing factors to get handled. Okay. Nutrition and environmental factors. Right. And it's beautiful because guess what? All we're doing is we're harnessing innate intelligence, the body's ability to heal. We're letting it out of the basement for like a minute. Okay. Let it out of the basement. Let it do its job in the same way that the edges of that cut begin to heal. Metabolic health, immune health, etc. The edges of that cut begin to heal. Okay. And it's awesome. You saw this, Mike, in 2020. Okay. Especially on the East Coast. Well, you guys are all death and doom and gloom all the time with COVID on the East Coast, right? I'm in the Midwest where everybody kind of just leaves each other alone. Okay. But on the East Coast, you saw these numbers, like in New York, you saw these numbers just skyrocketing for people that were getting bulldozed by COVID. Okay, why was that happening? Why? Right? Your body spends inflammation to kill a virus. Okay, you spend inflammation. So if you're living a lifestyle that's already high inflammatory and a virus shows up, you have no more room to spend. Okay, that's like living on your entire monthly income and then a medical bill is due. What are you going to do? There's nothing you can do. There's nowhere to go with that. And so what happens is because you're spending, most people are spending inflammation on their lifestyle, right? Too much Miller, too much bread products, etc. Okay. People are spending inflammation on their lifestyle. Now a virus shows up and you got nowhere to go. There's no inflammation left to spend on that virus, and that virus is going to have its way with your body. Okay. And that's what's been going on. So when you look at this, the goal for how do you help people heal? Stop spending inflammation on your immune system. And there's two ways to do it. Suppress your immune system with drugs, like methotrexate or prednisone, right? Cancer drugs or, steroids suppress your immune system, which you don't want to do that in the long run because that doesn't help you fight viruses, etc. Okay. But what happens, right, when somebody intelligently says, all right, I'm going to stop pouring gas on the fire. I'm going to see how I can feel. And people start to feel amazing. They're like, doc, I haven't felt this good in decades. I don't understand why people are not interested in handling lifestyle. And here's the secret: because it takes attention, it takes time, it takes somebody willing to be the most annoying person in your life for a couple of weeks, okay, and to coach you in the right direction. And that's really where I'm at right now, Mike. Is my goal is to make 1,000 of me. Okay, so I spent 11 years in clinical practice and had a couple of clinics and thousands of patients and consulting and stuff, and it got to a spot where it was like, all right, this is meaningless right now unless I can go and take and replicate myself, and we can absolutely upend the healthcare marketplace. Okay, and so that's what we've been doing. Been training providers for free. Been training providers through biogenetix.com, which is a nutraceutical company that I consult to. And if people want access to those trainings, they're called Casual Friday. Every Friday, we're going to meet for an hour and we go through a topic. If you want to learn about how to handle cholesterol, there's an hour on that. If you want to talk about heart disease, there's a whole month on that. If you want to talk about blood pressure, there's hours of it on there. And it's how to. I want to show providers how to practice, how to think in a clinical context, okay, so that they can help people get better faster. Better results faster is what it's all about. There's this problem with healthcare providers, Mike, and myself included, where the science part of their brain has to understand everything before they can help somebody. Okay. And it's a shame because there's a lot of logic that's being left on the table. And so what we've done is we've put together Casual Friday to teach people how to help their patients get better results faster, right? And it's for free. I don't know anybody else that's doing this, okay? But Biogenetix is making it available, and as long as they're going to make it available, I'm going to continue to do it because we've been doubling and tripling our viewership and participation rates over the last year, and I'm so excited that we are actually changing the face of healthcare, getting functional medicine out there in a low hurdle, right? You don't have to pay 10, 15 grand. You don't have to give 10,000 hours or 10 years of your life to this. You don't have to do that. You have to just spend Friday drinking a little coffee, watching Casual Friday. And so I'm so excited about it. So anyway, I can give you the link for that if you'd like to put it in your show notes. So that's cool.
Thank you so
Yeah.
much. We definitely need to put the link because I know that there are providers watching who say, yes, but I need to know more. Yes, but
Yeah.
he's a chiropractor. Can he help me with the knowledge and enough? Does he have enough credibility to give
Yeah.
me that kind of advice? And I
Sure.
want for all of the people watching, I want you to know that it's not only functional medicine clinics, chiropractic clinics, different clinics. It's also medical doctors who are asking Dr. Brad Watts for advice. And when he analyzes lab work for them and helps them figure out what to do with the patients, he sees that not only one time, but consecutively and consistently
Mm-hmm.
being able to see how the application of those principles actually produces results. And you multiply that over and over and over and over again to that extent that after so many years he's at the position he is at. I don't really know what's more important, if it's the type of degree that you have from years ago, or is it the practical application of the knowledge that you have evaluated by the experience and you can
Yeah.
see how it's working. So I know that people have always those objections and those type of blocks in their mind that I shouldn't do it because, and then they just look for a, like, why shouldn't I? Because it's easier. It's the familiar now versus
Yeah.
the unfamiliar future. And pay attention to what Dr. Watts said. Sometimes the urge to get everything figured out and the knowledge to 100% may be the very block that you have. to helping your patients. Progress is better than perfection. You can start getting your patient better even if you get everything 80% right. And then you figure out the other 20% that is needed, or maybe the 80% was enough to get the momentum going for the patient to get better, because innate intelligence kicks in when it's in the environment that it can kick in. So I think you can feel it. I'm very passionate about functional medicine as a whole, but specifically with Dr. Watts, and seeing how many people he is changing lives, and my family included here. So lots of respect to you, Doc. Maybe if you don't mind, I want to give one more example that may surprise people, because it was a big surprise to me. We talk about how our body functions. We talk about the environment and what are the parts of the environment. We also talk about the genetic testing. And I want people to know that there is ability to not only take the genetic testing to see what the map is. It doesn't mean you're going to use the map, but we can see what the map is. And then you're able to analyze the raw data of that genetic testing to be able to see things like your own predisposition to, for example, being able to metabolize B12. So,
Right.
for example, Mike Turajczyk, myself, yes, my result, I am, based on my genetic information, I'm not as good metabolizing B12 as somebody else may be. So if I'm in need of B12, and and correct me if I'm wrong with this, but the way I understand it is, if I need B12 and I start taking B12 that is not methylated B12, I can actually hurt myself versus helping the problem. But the lab work will say he needs B12.
That's right.
So let's talk about it, because to me, those are things that gives me chills. People have no idea how deep you can go with your analysis. Let's talk about it.
That's right. So DNA is really the dream of the 90s that never came into reality. Okay. In the 90s, the DNA projects that were there, as far as the government funded studies, etc., and I was just a kid in the 90s, were amazing at the outset, right? Because the goal was customized medicine. The goal was, let's make medication and lifestyle recommendations that are based on your DNA. Mike, you're going to live forever, right? That was the goal. And it never came into fruition, because if you start eradicating chronic disease, billions and billions of dollars are going to leave the healthcare marketplace. Okay. And so what's happened is the extremely helpful DNA research has been pushed off to the side a little bit more than it should have been, in my opinion. But thankfully, in the last 3 or 4 years, it's been coming back. And so here's what you're finding. You can analyze from a cheek swab, okay, a cotton swab on the cheek, send it to the lab, get your DNA report. We can analyze the raw data from that, and basically find anything out about your body that you want to know. What's your risk assessment for developing cardiovascular disease? What percentage risk do you have for developing diabetes? What type of B12 should you be using? Is one of them going to cause a neurotoxicity? Right? That doesn't sound good, does it?
No.
Is one of them going to be more helpful as far as controlling your blood pressure? Does your body have an absorption problem with B12, or is it a cellular uptake issue? You can basically get this down to the so nitty gritty that you go, well, now what? Right? And ultimately, what you want to be able to do is to take helpful information from your DNA, combine it with a lifestyle that matches it for optimal function. Okay. So if you got something going on in your life right now that's a problem, a symptom that you don't like, you have to ask yourself, is it genetic? Well, genetics never do anything without a lifestyle to turn them on. Okay. So what you want to do is you want to consider, is it genetic, and is there something I can do about it? Because if there was, would you be willing? That's the question. Okay. That's the question. So you think about things like erectile dysfunction that I mentioned earlier. You think about things like mood disorders. I'll just say that. You think about things like concentration and focus. Like, Mike, what did you have for lunch 3 days ago? Do you even remember? That's an assessment model that we use, right? just a one single question. What'd you have for lunch 3 days ago? Nobody knows, unless they're like, well, I fasted, right? They'll remember that. But what did you have for lunch? When was the last birthday party that you celebrated with your family? What was that? Like, questions in assessing your cognitive function. If you're over the age of 27, you're over the hump on your cognitive function, and it's on its way down unless you do something about it. Okay. These are things that we want to know about from a genetic perspective that will allow us to coordinate and build a lifestyle. Once again, I think this is probably the third time I've said it, a lifestyle that's compatible with health and healing, because ultimately that's what it takes. Okay, that's what it takes. And I get so excited being able to promote just this idea, this way of looking at the human body. I get so excited to talk about it because, I mean, in last year I crossed the 25,000 case mark in my career. Okay, 25,000 cases, wow. And last year I think I did 3,000 cases working with other clinicians around the country, medical providers, DCs, DOs, etc., NPs, DNPs, and the point is that what we want to do is we want to inspire people to take back control of their health instead of just going to the provider and being like, how come you can't fix me? It's not your doctor's job to fix you. Okay. It's your job. They're not the one living in your body. That's you, right? You are the one in charge. And ultimately, when responsibility shows up, I mean, amazing things can happen, and it's stunning. And you guys have seen it in your own life, you and your spouse. I mean, Miss Monica, she's done some awesome things with her health too. And it's like, it's so fun to see people get it, and it clicks, and they go, oh, I wish I would have known this 20 years ago. Right. So it's amazing.
It is
The research that's out there, by the way, oh, the research that's out there, you're using all of the tools that modern medicine is using. You're just using them from a different viewpoint, right? And so insurance companies don't pay for a lot of the testing that's required, right? Which is why we band together with 2,500 doctors, through buying groups, and you can get $2,000 worth of lab chemistry for $120, right? It's like, it's unbelievable. And it allows you full scope, full access to what science has to offer in 2021. And it's just about coordinating it and putting that information together in a way that makes sense for people to take action. And that's really what we teach on Casual Friday series webinars through biogenetix.com/library. That is the link. I remembered it here for you. So,
oh man, I'm just so passionate about this subject. I know how much it means to a single person, a single family. Yeah. How much does that mean to a group of people, to a society, to a country, or to humanity overall, to actually be able to, do the right thing, or at least have the guide to know that there are many things that you can try
for example, think about this, Mike. Think about this. The other day, gentleman, so the other day, meaning probably about 4 months ago, a gentleman comes in and he's got a massive diabetic complications where he can't feel his feet, and they're starting to turn purple, and what a mess, right? Doctor tells him, you got to get this under control, or you're going to have amputation of some of the toes on that foot coming up. Right. It's that with diabetes, those complications, the body begins rotting from the ends, like from the tips up. And it's not awesome. Okay. And so this guy is a laborer, right? You can't be amputating part of your limbs and still go out and, work in a construction site. Those two things are not compatible. And so gentleman has to figure out how to control his blood sugar so that his nerves can begin to heal. Okay, so that vasculature can begin to heal. And so you go through the process, you look at what are the issues with his food, what are the issues with the inflammation in his blood chemistry, do we have any issues with detoxification that are blocking his body's ability to regulate inflammation, etc. Go through that process and start driving nutrients that the laboratory testing is saying are required. Start driving those nutrients into the tissues, and a gentleman starts walking away from the neuropathy issues that he has. It's amazing. So people usually go from paresthesia, so numbness and tingling just a little bit, to pain to numbness. Well, he goes backwards from numbness back to my feet hurt again. You're like, well, and you fist bump, you're like, yes, your feet hurt, right? And it's kind of a weird thing to get excited about, but that's what we're doing, is you're moving backwards through that ladder into the paresthesia scenario again, where there's a little bit of numbness and tingling, right, without the pain. And you start to move that gentleman towards a spot where his doctor isn't going to require him to have his toes cut off, and he can stay productive for his family. What does that mean for a family where the dad doesn't have to be sitting at home collecting, like disability, when he can be out making money and participating in society? And like, he's a builder. You get that stuff in your heart where you want to go build things, get that out and like start participating in society again. Like, that's what I'm talking about. That's the power of, logical healthcare, in my opinion. That's the power of doing what you need to do. And just, that's one story from thousands of them that, doctors all around the country are participating in. Not just doctors, nutrition coaches, nutritionists. It's amazing. So it's amazing.
It is amazing. And I am ultra excited, and I want all the providers watching us right now to really deeply think about the meaning of what we're talking about and how it relates to you as a provider, and your responsibility when you know that there are options, that there is information that you don't know about, or maybe you don't know everything about and you want to find out more. And then your ability as a provider to be able to be a part of a success of your patient. And I'm not talking about the lab number going up or down, because this is just the way that we measure things. I'm talking about the real life examples of how the enjoyment of life changes for a family member. So you as a provider, you're in this amazing position to make the difference in people's lives. I really encourage you to connect with Dr. Brad Watts, because he has a lot of resources. And as we talk with Dr. Watts, he knows that no single provider is the ultimate alpha omega type of situation that he will be able to, or she will be able to help you or help the patient. But the collaborative approach that is possible right now through the internet, through all those Zoom phone calls, this is something that is this is something that is so meaningful to us. So think about that patient that comes to you that tried so many different things, and they ask you, what can I do next? And then there may be a good answer that you have for them. So I encourage you to look for those answers, connect, ask questions, and then become part of a group like what Dr. Brad Watts is building. Become part of our group, Doctors Networking Group. This is really, really meaningful. And it's meaningful not only for us, it's for all the people that we're going to be able to help. So thank you so much. It's been not only fun, but it's been very, very meaningful. And I'm thinking we're going to have a part 2 or part 3.
Yeah, that's great.
Specific subjects.
That's great. So, all right. Well, thank you for having me. Happy to be here.
Really appreciate it. See you next time.